Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. I've entitled this episode Social Media Skincare Trends, Good, Bad, Helpful, or Dangerous. And I'm recording this in early 2024. And so as we can imagine, social media skincare trends are constantly evolving and changing. But I picked a top 10 that I want to address because in the heyday of social media, which is our present time, including TikTok, Instagram, Facebook, etc., there are random people or influencers, in addition to healthcare professionals and doctors, weighing in on all sorts of skincare issues. And it's pretty hard for a person to sift through the information and figure out what is true, what is false, what is helpful, and what is harmful. I think it's just very hard to figure it out. So I'm going to try to hit the most popular skincare trends on social media today and give you an honest answer on what they are and why they might be good, bad, or neutral. So here we go, and these are in no particular order. Let's start with skin slugging. Skin slugging is a weird term, but it just refers to the practice of moisturizing and then adding a layer of Vaseline petroleum jelly on top of the moisturizer to seal in the moisture and superhydrate the skin. It is true that this will work. If you have dry, sensitive skin, it may even be good for you. I've been recommending Vaseline petroleum jelly as a moisturizer or an extra moisturizer for many, many years. However, if you are prone to breakouts, or have acne, or have oily skin, this treatment is not for you. It will clog your pores and make your skin break out. So this trend is okay and helpful if you have dry skin, but harmful if you are prone to oily skin and acne. This is pretty straightforward, and I don't have anything else to say about it. Next, let's discuss skin cycling. Skin cycling is a trendy term for rotating products that you put on your skin, particularly retinoids, but it really means rotation of anything. This is good and very helpful for many patients. In fact, I would say I recommend this for the majority of my patients for as long as I've been practicing. Whether it's anti-aging products or anti-acne products, it's often helpful to get more than one active ingredient on your skin, and they may not always go together, so rotation is good. One night a retinoid, another night something else. Sometimes retinoids really are hard to tolerate every night anyway, so they end up in a rotation because that's the easiest way to use them. So this is pretty basic and it's helpful, not harmful. But if you have very sensitive skin and you can only tolerate one product, for example, then skin cycling is not going to be for you. There is no point in cycling products just for the sake of rotation if the products irritate you. So in summary, this trend is okay for most people, but to avoid it if you have very sensitive skin and rotating products just doesn't work for you. Skin cycling is also pretty straightforward and simple, and I have no other commentary on it. Now we are moving on to the use of hydrocolloid skin patches, which seem to be very popular on social media, otherwise known as pimple patches. And these can be very helpful to put on as a spot treatment on a pimple, and it sometimes can make it go away faster. But these do not work for cystic acne, and they also do not address the root of the problem, which is to control the acne so that you do not need them. So if you are prone to acne or breakouts, I would say listen to my acne or rosacea podcast to hear about what you can do on your own, and also seek care with a great board-certified dermatologist to get your skin under control, and then you will not need these skin patches. But as long as the person is not allergic to them, I don't believe that they are harmful to use on occasion. So another simple analysis on pimple patches. A slightly more complicated topic, I would like to discuss vampire facials. And this is a term that refers to PRP, or platelet-rich plasma therapy. And typically, if someone's using the term vampire facial, they're taking the PRP and rubbing it on the skin after a microneedling session. So it's not a facial at all, and there are no vampires involved. First, let's discuss the PRP. PRP, platelet-rich plasma, is when we take the blood out of your arm, spin it down, take out the red cells and white cells, and we are left with plasma. We concentrate the plasma a little bit, resuspend the platelets, and then we either rub that on or inject it into people's faces, scalps. Orthopedic surgeons use it a lot for joint rejuvenation and sports medicine. So I do perform PRP. I will do it on the scalp a lot for hair loss. If I'm going to do it on the face for anti-aging, to stimulate collagen to grow and to give a nice glow, personally, I inject it all over the face to make sure that it gets into the right level. And I would consider this a completely experimental treatment that has not been proven to do anything. But the patients who do use PRP on their face, in my practice, do like it and feel that it gives them a nice glow. I will provide the service if people want it, but it's not something that I necessarily recommend all the time. I am, however, not a big fan of microneedling, just because in my practice I feel that I can get the great results with peels and lasers with basically no risk, and microneedling has some risks to it since the surface of the skin is being broken. So I'm not a big fan of microneedling, and I'm not a big fan of the vampire facial as it is usually advertised. That said, if it's being done by an experienced dermatologist, it is possible that it can improve the skin, but it is not proven. And I would say, generally speaking, there are plenty of better ways to spend money and time to improve the skin, and I would not put vampire facials on my list. Now let's talk about dermaplaning. This is just a fancy term for shaving your face, although if you do dermaplaning treatment at a spa or a doctor's office, they will often try to go a little bit deeper and remove the top layer of the skin to help smooth the skin in addition to removing any peach fuzz. So it can give a nice glow, make your skin look nice and even, but it's not really a major procedure. It's typically fine for patients to do on a semi-regular basis if they like it, as long as they have no active skin issues. If you have rosacea, eczema, acne, very sensitive skin, I would say this is not going to be a good treatment, as it's going to be too harsh and irritate and potentially can cause an infection if there is active acne. So dermaplaning is okay for patients without active skin issues when done properly and if not too aggressive. If it's used too aggressively or on an improper patient, there definitely can be issues with it. So this is pretty straightforward. Moving on to face yoga. To me, face yoga, which is basically repetitive facial motions that are supposed to help with anti-aging and help people look younger, this makes no sense. To me, it's counterintuitive. I've had the privilege of working for over 2 decades, and I've watched my patients age over time, and the people who keep up with their Botox, stay out of the sun, do some fillers as needed, take good care of themselves, their bodies, and their skin, they just look great over time and age appropriate when their cosmetic injectables are done by great doctors. And we are spending a lot of time and effort trying to remove the effects of repetitive facial muscle motion with Botox and sometimes with filler. So I just don't see how repetitive facial motions are going to improve wrinkles. To me, it seems like they would make them worse or at best be neutral. So I just don't understand the point of it. I would say it's unproven, potentially mildly harmful from an anti-aging perspective. But if you do not care about wrinkles and facial yoga makes you feel better in some way, then sure, go ahead. I don't think it's going to do any harm, but I certainly don't think it is going to do anything good for the anti-aging of the face. Next is facial rollers and gua sha. I'm really not sure if I'm saying that properly, but I think many people will be familiar with these facial rollers. They're very common. It's fairly simple. There's all different types of facial rollers. I don't see any harm in them if you have no skin issues, but I also don't think it does anything. So if you like to do facial rolling and it does not bother your skin, I don't think anyone needs to stop doing it, but I also don't think that it improves anything in terms of anti-aging. If you have skin issues such as acne, rosacea, eczema, sensitive skin, I do not recommend facial rollers. It could absolutely aggravate any of those conditions, but if you don't have any skin issues, it's likely not harmful. Now let's discuss lymphatic drainage massage of the face. This is just a technique of facial massage that might or might not do anything. Similar to facial rolling, I would stay away from this if you have any skin issues, such as rosacea, acne, eczema, sensitive skin. But if you have no skin issues and you like facial massage, I don't think this is harmful, but I also don't think it does anything significant. So last but not least is skin streaming. This is just a fancy term for streamlining your skincare routine to just a few products, which I have been recommending for as long as I've been in dermatology. Skin minimalism or minimalism, I'm not sure how you pronounce it, is basically the same thing as skin streaming, minimizing the number of products that are used on the face, simplifying the process. I really pretty much every day do skincare consultations, and when I do this, I recommend that patients bring in their products to show me what they're using so we can go through them and decide what's good, what's bad, what's neutral. And I prefer to see this with the ingredient lists, but the interesting thing is people bring in large bags of things. I mean, bags and bags of products that they've bought that they're using. And usually most of it is garbage. Some of it is okay. It depends on the bag of the stuff that they brought in, and I will go through it. But really, more is not better, and this is just a gigantic waste of time and money. Everybody needs a basic cleanser, a basic sunblock, usually a moisturizer. If your skin is very oily, maybe you can get away without one or use an oil-free version of moisturizer. And then products with active ingredients, depending on what the skin issues are. If someone has rosacea, they're going to be on a particular program, which is different than the program for acne, which is different than a program for eczema, which is different than a program for hyperpigmentation. But when I have somebody on a program, I will often recommend that they rotate their products, and it may be as few as one. I'd say the most I ever recommend is 4 or 5. That's unusual. So I agree people should streamline their skincare program to just what they really need and what works best for them. Tons of products are not necessary and a waste of time and money. So that is my assessment of the top 10 current social media skincare trends. I hope that was helpful and that it helps you sift through what's good, what's bad, what's neutral, and what might be appropriate for yourself or to ask your doctor about. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.